Hi, this is Dr. Mary Kathleen Figueroa coming to you from the Thyroid Channel. If this is your first time, know that this is for educational purposes. If you have specific complaints, please discuss with your local endocrinologist. Today we'll be discussing postpartum thyroiditis. First, we'll discuss why it's postpartum. The act of pregnancy, even if it's ended early due to pregnancy loss or due to abortion, changes the immune system dramatically and can have effects on the thyroid. After pregnancy, either with delivery or with abortion, sometimes the thyroid gets inflamed immunologically. And it's been estimated between 5 and 15% of women after pregnancy can have postpartum thyroiditis. So thyroiditis means inflammation of the thyroid, and the thyroid inflammation causes several symptoms. Postpartum thyroiditis happens in 3 phases. The first phase is hyperthyroidism, and that can happen between birth and 3 to 4 months after delivery. And during that time period, a person has symptoms of hyperthyroidism. They get very hot, very irritable, they lose weight more than might be expected after delivery. They can have problems with insomnia beyond what happens with normal delivery and normal newborn status, and just be very emotionally withdrawn and different. And if thyroid levels are checked at that time, TSH, free T4, and free T3, often hyperthyroidism, mild hyperthyroidism with low TSH and high normal T4, T3, or even abnormal T4, T3. The second phase of postpartum thyroiditis is hypothyroid. So after the gland puts out too much hormone, it can stop producing hormone, and then cold hands, constipation, fatigue, immense fatigue, weight gain, swelling in the lower extremities can occur for another 3 to 4 month period. The last phase of postpartum thyroiditis is resolution. This doesn't necessarily have to happen, but you can stay in the hyperthyroid phase or in the hypothyroid phase. But the vast majority of people, women, after having postpartum thyroiditis, completely recover. And for this reason, postpartum thyroiditis is often not treated with medications. There are certainly exceptions, and certainly if this is a concern for you, you should discuss it with your endocrinologist. So let's talk more. We've now learned there are 3 phases to postpartum thyroiditis. What causes or how can it be diagnosed? Largely through labs and through measures of antibody levels, as we discussed the labs TSH, free T4, and free T3, as well as anti-thyroglobulin antibody or anti-peroxidase antibody, which is more specific to the condition. Next, that we've discussed how it's diagnosed, what's the treatment? So as I said, often it's watch and wait and letting the person know that their thyroid is not properly functioning. It can help a person feel less overwhelmed and less at fault for their inability to control certain symptoms that are associated with thyroid function or dysfunction. And if the changes in thyroid function are dramatic or pronounced or continue for many months, then it's appropriate to treat, with the idea that the person would come off treatment when those symptoms abated and when the next phase of postpartum thyroiditis started. So treatment is individualized. And then prevention. So how would you prevent this? Certain studies in the early 2010s showed that selenium would be a good addition, and I presume also iodine, having sufficient iodine. And if you are prone to immunological disease, any kind of emotional instability or any kind of motor vehicle accident or any other sort of change in your thyroid function or change in your life can lead change in your thyroid function. So you'd want to avoid and minimize these. So to summarize, postpartum thyroiditis happens in 3 phases. They are hyper, hypo, and then resolution with normal thyroid function. And any individual woman can have difference in either having hypo first, or having hyper and never resolving, or having hyper and hypo and not resolving, or simply having very mild changes in the levels of thyroid function. And the treatment for it is individualized. Prevention of it can be done with sufficient selenium and iodine in the diet. Otherwise, there's no known prevention for this besides not getting pregnant. If you've enjoyed this video, please give it a thumbs up. If you'd like to subscribe, please do so below.